international traveler diagnosed with measles may have exposed people at O'Hare Airport. It happened in the morning of June 17th in Terminal 5. It's having a lot of people talking about what to do if this happens and next steps to take. So we wanted to get you some answers this morning. We've got Dr. Dua with us, surgeon and founder of Healthcare for Action, here to talk all about it. Thanks for being here.
Thank you for having me.
Yeah, absolutely. So let's start with, how concerned should people be hearing this information?
Well, measles is highly contagious. This happened on the 17th of June, and essentially, if you were exposed potentially in that time, as long as you're vaccinated, there's a really high chance that nothing will happen. In people who are immunocompromised, pregnant women, children, or who have not been vaccinated, measles, because it is so highly contagious, if you were exposed, you're quite likely to have symptoms. And in the cases of those people, they really need to be watching themselves for up to 21 days after the exposure. And if they notice anything like fever, cough, or rash, then they do need to get to their doctor right away.
Yeah, you said it was really contagious. I mean, how contagious are we talking? Like, if someone just walks through there during this exposure window, could they contract it?
That's an excellent question. The answer is resoundingly yes. The way that measles is spread is through breathing, essentially. So little droplets go out into the environment. So imagine you're at O'Hare, Terminal 5, you're walking around and the person next to you has measles and they're just breathing, and you walk right beside them and you inhale. You could get it if you are not vaccinated or if you're immunocompromised or something of the sort, as I mentioned earlier. Measles is one of the most highly contagious diseases out there. In fact, if you're in a room, if there are 10 people in there and someone with measles walks in, 8 of those 10 people, if they're not vaccinated, will get it. But the good news is, because of vaccinations, and the majority of the people are vaccinated, we do have a lot of protection in our society.
Yeah, definitely. Wow, it's wild just how contagious it is. You were talking about the symptoms a little bit. I want to know, when can those symptoms appear? It sounds like it could be pretty quick, or it could be a couple weeks.
Exactly right. So it can be anywhere from 7 to 21 days, typically, is the period of time. If we're talking about the numbers in terms of actually exposing yourself, if someone were to breathe next to you, those droplets can remain in the air for about 2 hours. After that, they're gone. So you can freely go to Terminal 5. Everything will be fine today. But if you are exposed, you can harbor the disease within you without showing any symptoms for up to those 21 days. So essentially a month. So you really do need to watch yourself if you were in that environment on that day.
At what point do you call the doctor? I know a lot of people are just so quick to say, I got to see a doctor, I got to see a doctor. But at what point do you get there?
Honestly, for this, because it is so contagious, you have to first of all think about yourself. So, for example, let's take the worst case scenario. If you were not vaccinated, if you potentially are immunocompromised or you're pregnant and you're in a situation where you are really susceptible, then I would call the doctor much earlier. Say, look, I was exposed. Maybe at this point I don't have symptoms, and the doctor may ask you things like, hey, have you checked yourself for a fever? Have you had a cough? Have you noticed any odd rashes on you? And then kind of guide you to whether or not you actually need to come in for care. If you are somebody who is vaccinated, then the chances of you actually getting the disease, even if you were exposed, is incredibly low. So in that case, I would usually wait for something like those symptoms to appear before calling the doctor.
Okay. So this isn't like a rush to the urgent care or ER or something like that.
Definitely not, unless you are starting to show symptoms. And it is important, if you do feel like you were exposed and that you could spread it to other people, that you do quarantine yourself. However, at this time, as I mentioned, most people are vaccinated. But unfortunately, in the United States over the last year, we have had a number of outbreaks that we've never seen previously. And that's really something to be concerned about, because we do have so many people either not getting vaccinated or internationally traveling that are exposing us to measles.
Yeah. And when you do get vaccinated, how quickly can kind of things start working and moving?
So that's what's pretty amazing about it. So most people usually get 2 vaccines when they're children, and that vaccination process actually lasts you your entire life, which is incredible. It's over 95% effective, which is, again, quite an incredible feat for vaccines. In fact, this is one of the few vaccines that even RFK has said, yes, for measles, get vaccinated.
Dr. Dua, my last question for you, just if someone is concerned, if they were in Terminal 5 at that point, they're really, really worried, what could you say to them?
I would say it's most likely okay. Number one, again, I hate to keep saying it again and again, but I will say it. If you are vaccinated, the chances of you being protected are incredibly high. So don't worry. Just watch yourself for symptoms. If you are somebody who is not vaccinated, or you have a child who's not vaccinated, then absolutely watch yourself for symptoms, because it's hard to tell who that person was and where they were at a specific time. But know that our United States kind of response is excellent. Exactly what we are doing right now, we're supposed to be doing. Somebody identified the problem. They ensured that the people in the terminal had to be monitored, and we have a lot of things in Chicago to take care of us if there's a problem. So ultimately, you are safe, and even if you were exposed, we can take care of you.
All right, Dr. Dua, very well spoken. Thank you so much for putting this all into perspective for us today. We appreciate you.
My pleasure. Thank you.
All right, we'll see you soon. Guys, we'll be